Well, as more and more people look to Dr. Google for medical advice, Turkey's biggest mobile operator, Turkcell, is partnering with one of the world's most recognisable medicos, Dr. Mehmet Oz. The cardiac surgeon, made famous by his appearances on the Oprah Winfrey Show, is joining a team of other doctors and fitness experts to provide health information on Turkcell's BIP service. Dr. Oz, who was born in Cleveland, Ohio, and is also Turkish, will be providing medical and lifestyle advice, ranging from healthy eating tips, exercise plans, and ways to reduce stress. Well, I sat down with Dr. Oz in Istanbul and discussed the pros and cons of going online for medical advice and about the relationship between money and health. He also threw in a bit of career advice, but I began by asking him about his new digital platform on Turkcell's BIP service.
BIP is important because it's messaging programming, and the messaging program already has quite a few subscribers. We already have 250,000 subscribers to my site, Dr. Oz and Friends, even though we didn't launch till just now. So there's obviously a fair amount of interest in this because they can customize the messaging to their own country. And we're seeing this in China and Russia. I mean, countries are realizing data is the new oil, and you want to control your data. So the ability for me to be on BIP as one of their platform players allows me to bring the richness of the content I do around the world. We're in almost 100 countries, and this is my 11th season I'm starting. And I have 20 million viewers a week on television, but another 12 million on social media. So let me get to them by doing it country specific. If it's a big enough country like Turkey, it's worth the investment.
I want to ask you now about the Dr. Google phenomenon. WebMD is a popular platform. You've actually partnered with the founder of WebMD, Jeff Arnold, to launch ShareCare back in 2010. Now, so you obviously think there is a solid future for people going online to seek medical advice. So why have you ventured into that space now?
I actually never minded Dr. Google. What I minded was people believing Dr. Google without auditing what they were hearing and not challenging it with what their doctors were telling them. Because remember, the word doctor means teacher, right? Doctore, Latin, teacher. And so use us. Do your homework. That's going online and searching why you got that weird rash. But then come ask me about it so I can do a little quality control. WebMD is fantastic, but WebMD was the first generation. It was always supposed to become your personal source of information. And to do that, I've got to know more about you, and I've got to work with you and get you into the healthcare system in the right way. That's what ShareCare does. It's a $500 million revenue company now a year, and we're in a bunch of different countries. But it is one example of how it's going to look. No matter where you live on this planet, your cell phone is going to track what you're doing if you wanted to, give you clues like a coach, and then connect you to the healthcare system to get the best value when you don't feel well. So you want that. That's where we're all headed. Doctors will be part of that puzzle because you'll want to quality control what you're hearing, but in a smarter way.
Now, you're clearly a bit of an overachiever, but you were an overachiever at a young age. In addition to your MD, you got an MBA from Wharton as well. Now, what made you want to get an MBA? What about business interested you? And did you always see yourself connecting business with the medical world?
I realized pretty early on that medicine was run by money. It's not that doctors aren't good and people don't care about healing. Of course they do. That's why we all went into the field. You never work as hard as we work, nurses, therapists, if you didn't care about the people. But to invest in the technologies that make medicine better, whether it's just collecting data on what you're doing or new machines to do x-rays on you, or better technologies to fix you without the old-fashioned invasive surgery, you have to make monetary decisions. Why shouldn't doctors be at the table? Why do I want a bunch of administrators figuring out where we're going to put our resources? I want it to be there. And if I don't know how to read a balance sheet or understand basic concepts of finance or even marketing, which is what you learn in business school as well, or management, then I won't be able to be part of that solution.
Now, you obviously, before you ventured into TV and now online, you were a successful cardiothoracic surgeon, you were a professor at Columbia. Do you miss doing more of that hands-on stuff?
Well, I still operate. I'm still in the faculty. I did an operation right before I left. And I take great pride in the fact that I get to still take care of patients. But it's different. I'm not a doctor every day like I used to be. I used to do the most heart surgery in the area where I live, New York. And now I help my colleagues that I taught do surgeries and give them advice. And they talk about, they talk about the things I used to do, not the things that I'm doing in the future. And so it's a sacrifice. But I think we all have that point in our lives. And I got this advice when I was a young physician. It's wise. Don't shift careers when you're at the top of your game. Shift careers when you're heading towards the top of your game, because you're still heading up. Jump off then so you can keep going even higher. We all have an obligation to the people that taught us and to the people who trust us with our advice. And we got to go to the next step. And a lot of folks, they rest on their laurels. And yeah, you'll fail and it hurts. You'll fall down and skin your knees. But that's what life's about. And I sort of on the 10-year plan. Every 10 years, I want to make a significant change in what I do in my life so I can make sure that I can say I did it. Otherwise, I'll look back and think, gosh, is that all I did? I did another 10,000 heart operations? Is that all I had to offer the world? And
You mean saving lives?
Well, I mean, saving lives, and I love doing that, but I'm purposely picking that as an example because, of course, I would be proud doing that. But then in the back of your mind, no matter how noble what you're doing is, you got to still think to yourself, could I have done more? Just for the business folks, you know, of the top 10 stressors in life, 7 are financial, if you include things like divorce. And it turns out that not addressing monetary stress is one of the biggest drivers of illness. In fact, the major driver of bankruptcy is being ill. And a major cause, especially in America, and the major cause of illness is the stress from financial issues. So the folks in the financial world ought to be aware of this, because when we make decisions with money, especially if we affect other people's lives and don't respect the kind of impact we have on them, we're throwing away an opportunity for us to help too.
Good advice. Dr. Oz, thank you again.
Bless you.